At the beginning of the epidemic in DC, people were organizing already. They were organizing just after perhaps receiving their own diagnosis and seeing the impact on their own lives. This project would give us an opportunity and others an opportunity to show our respect and appreciation and gratitude to these individuals and organizations that made such a difference in people's lives in the early days of the epidemic when people had nowhere else to go.
Well, it's clear we stand on the shoulders of giants.
That's right. Mm-hmm.
And we're going to celebrate those giants with this video archive series, I hope.
Right. Yes.
So my husband died January 1st, 87. And then 6 months later, my baby died. She was 3 years old. When I went to my doctor, actually, I asked her if I was the only woman because I didn't know any at the time. She said yes, but she couldn't give me any information. And I made a flyer and put it in her office and said, if there are any women living with this, I just wanted to talk to you. So I put a secret phone line in my home, and on the flyer I said, anybody interested in talking to somebody, another woman, please call. And lo and behold, the phone started ringing, and we started just having a group on the phone because none of us wanted to show our faces. And step by step ended up with a support group in my home that then evolved.
There are two stories of what brought me to the work. You know, there's the Whitman Walker working as a volunteer, and then there's this story of my best friend. Then he got sick, and he called me at the only non-AIDS job I'd ever had and said, you need to sit down, I need to talk to you. And I said, you know, as long as it's not that you got that shit, I'm good. And he said, you better sit down. And I sat down, and he told me he'd been diagnosed with AIDS.
My friend Conrad Nye Jones went to San Francisco to celebrate supposedly our marriage. Back then you didn't get married. But we went to San Francisco, and I think it was on the third day he got ill. And when we came back, we came to GW in the old hospital across the street. Some of the doctors came down the hall and said, well, your friend has AIDS and he's going to die this year, and so are you.
When I was at Howard University volunteering, I would go over to Children's Hospital and sit with the children at night. And I think it was the second child that died, and I happened to be there. And that was one of the most difficult things because I started thinking to myself, this is not stopping. Many of their parents were deceased from HIV. And I think that was probably the most challenging, working with children that they were born with the virus. And so the only thing that you saw them do was suffer. It wasn't as if they were adults and never had an opportunity to live, but they came into the world suffering, and pretty much that's how they passed away.
My family lost my older brother in a bike accident, and then about a year later, my younger brother told us he was HIV positive. So this was in 1990, and so my childhood family went through a tremendous amount, and so my connectivity to HIV is really personal. I lost my brother, who was 14 months my junior, in 1999.
I have a picture frame that's in my dining room there. It's a whole big picture, and when I tell people that all of the folks predominantly on there are deceased, like 50, 60 folks, and that's a small amount, but you know, I actually got to see in the early years my friends, when they start talking about ARC and all of that, and they start just drilling away.
It was horrible. I mean, it was just horrible, you know? There was a time when I would just cry. It was like just, people were dying, no one knew why. Doctors were afraid to examine you, nurses were afraid to feed you. Folks were dying, it was like starving in hospitals because nobody would bring them food unless, I mean, like you've seen the movies like The Normal Heart. I mean, all that stuff was really real. And each day, well, it got to a point where by 95, that was the heaviest. 95, by every 10 days, someone was dying.
I realized later, and always give credit to the early activists, because they are the ones that demanded that there be community members at the table of research from the early days of ACT UP. They wanted to be at the FDA tables at NIH, and they made it very, very clear in a very dramatic fashion sometimes that, that we have a right to be at the table.
I was motivated to participate in this work because I was really interested in community building and gender, and I thought mistakenly that in our community HIV was primarily experiencing women, and I learned in the work in the late 90s that our community was primarily experiencing HIV among Latino, gay men, bisexual men, and transgender women.
We started as a private practice in social work with concerns about the lack of access to behavioral health services for African Americans, minorities, and African Americans in particular. In the late 80s, I was hearing more and more about AIDS, about the AIDS epidemic. But the focus in the news was primarily on gay white males, and in particular, middle-class gay white males. There was not much mention of African Americans.
In 1995, I started my activism work within the community, and I started DC Fights Back in 2005. My primary areas of focus started with HIV and harm reduction, and it's broadened since to LGBTQ senior housing. So those are the three core areas that I really focus in on with my work.
Today we have so many more resources that we didn't have back then when I came up. And I said, guess what? We didn't have transgender programs. We didn't have HIPS. We didn't have us helping us, all these different programs. And I said, so I had to survive.
I began at DC General Hospital's HIV Center. That hospital has since closed. It was the city's only public hospital in the HIV Center. And there was just something about the frenetic energy of that place. And just walking in there, you understood that this was a place that you could make a difference.
It's only when I started getting into public health and really started working in the field in 2006 or 2007 that I really began to understand what HIV looked like and how it affected communities here in the district.
When you hear about something, you walk into the community, your eyes are blinded. You don't see it. Then after more and more people came forth, just said, hey, I'm HIV positive, I need help. And then when you hear about the effects of HIV, when you hear that there are 1 in 20 folks that are infected in the District of Columbia, that becomes very real.
We started out as a support group for Black gay men who are HIV positive, and when I turned positive in 1990, I joined the group in 91. What was so unique about it was that it was the only organization at that time, AIDS organization, that was the only Black one that was saying you could live with HIV. They started in 85, I joined in 91, so this idea that there was no cure, that was effective. People were told you're going to die in 6 months. So to have an organization and a Black one saying, no, you can live with this disease, that was just mind-boggling.
At this particular date and time, I focused on the senior population since I've reached that senior age. And the focus is long-term journey and a long-term protocol of how to live with HIV as a person who was diagnosed in the 80s.
On my unemployment check started what was then the National Women and HIV/AIDS Project and later became the Community Education Group. The access to treatment is the bigger hurdle right now, because I think we have a lot of options, but not everybody has access to those options.
When I heard the government actually talk about treating the whole person, that was a big step here in DC, and it took a lot of activism work. The area around U equals U has been a big a winner for us, and especially in the LGBTQ community, where we're often judged as being dirty if we have HIV, and that changes that conversation.
I think one of the advantages of having been in a community-based organization for so long is that you see people over time really overcome deep personal challenges, and you have to stick around for a while, right, to see that kind of change in people. I think the joys related to our client achievements have been the most profound.
The first AIDS ride was from Philadelphia to DC. Horrible, all hills, on an old Raleigh bike, made out of lead or whatever it was made of. So we're doing these hills up and down, back and forth, and I was like, I can't do this anymore. And you know, we didn't have cell phones then. So I stopped at the payphone and I told my sister, I want you to come and pick me up, because I can't do this anymore. And it had been July. And if you look to the front and look to the back, there was no one there but just me. And she said, well, you're not doing this just for you. You're doing this for the people that can't do it, and you're doing it for people that are in front of you, and you're doing it for people that are beside you. You may not see them, but they're there.
All of the CFARs are, to my knowledge, engaged with their local communities, but in Washington, D.C., we've really tried to make it a hallmark of our CFAR. And this starts with our mission statement, which is to try to end the epidemic in partnership with government and community. And then under the leadership of our community director, Ms. Marcia Ellis, we've really tried to engage and look for ways to engage the community in really all aspects of our work. And that includes the full range of activities from being engaged in strategic planning, to reviewing pilot awards, to having community events, educational events about the science that's done in Washington, D.C. and elsewhere, and serving as co-directors of all of our scientific working groups and scientific interest groups.
I was very, very honored to be part of this group of community members who, they were specifically, the CFAR was seeking people who were leaders and trailblazers in the community, who had reach to the community at large, and people who they could access for input, and they would represent the voices of so many more people, because they were heads of agencies that were actually providing the kinds of care and support and love to people who would not be at the table.
So the cultural humility element has to be on par with the scientific advancement and investments. You have to have both. You can have scientific advancements in medication, in treatment, what have you, but if you don't have the cultural humility to engage people in that, what good is that? Then we have treatment, but we can't actually get it to the people we need to. And so this is the issue that we're going to struggle with. We love science, we love research, we want to do more, and we want to do right by our patients, but we oftentimes forget about actually asking about what they truly need. And so I think that humility is as much as a part of the secret sauce as the science is.
When you're starting your career within research particularly, to go into the community and just sit and listen for a period of time before you go in and trying to use your book knowledge on things. Listen to what the community has to say. The community has a wealth of knowledge, and it's upon you to find out what that is and to build a trust in the community that you're not there just to use them to get to the next step, that you're willing to be a part of the community looking for the outcomes that we need to end the epidemic.
If we are going to continue this work and continue this fight, I think we have to do it together.
So we see the CFAR really emerging as one of the leaders that is trying to find out ways in which we can tackle this disease. As we were looking at the effective behavioral interventions that we instituted, in some cases we work with partners to maybe we need to modify it just a little bit for the population in which we were dealing. We got that support from CFAR folks. It was good to share around the room what you're experiencing in different neighborhoods, how we can apply best practices. So again, the CFAR was there for us. It brought together not only health departments, it brought together other folks that were doing the same thing. So it was bringing together the nonprofit community, it was bringing together clinicians, it was bringing together those that were involved in research.
Marcia has done an incredibly effective job of engaging dozens of community leaders from throughout the city to participate in our community activities. And very importantly, through her work, enables us to keep the community very engaged and aware of some of the cutting edge HIV science that's being done in Washington and elsewhere.
I want to acknowledge that we've come a very long way. We still have the work to do, and the community boards, the activists are still needed. Everybody who was needed in the beginning are still needed now, and sometimes even more so now.
There was a lot of work done to make people aware of HIV disease, but many people felt like it didn't affect them. You know, they weren't at risk. So getting people to acknowledge that they're at risk is a problem that exists today. I consider that still a major challenge.
We need to work together, and we have to do more to ensure that young people who do not remember what the 80s looked like, right? I was born in the 80s and I don't remember what HIV looked like because I wasn't around when people were dying, right? We have to do more to ensure that people aren't afraid, but that they're aware, they're confident, and they're able to use the tools that they need to prevent this disease. I think that's really, really critical. In order to do that, we have to address the social determinants of health.
There are still people getting infected today. There are still people dying of AIDS today. So just because you have medication does not solve the problem. There are a lot of other issues going on that a lot of the agencies were helping with, medication, with doctors, with food, with housing, with homelessness, with mental health issues.
And even for those testing positive today, it can be a challenge for people to accept that you can grow old. You can grow old with this, that this is not an end for you, and this doesn't define you. And you can adjust to dealing with this, and you can move on with the goals that you had set for your life.
I felt like my position is that someone has to be a mentor, has to be that picture of HIV so others will understand that it's not, if you get it, you can live with it. But also if you don't have it, you don't have to get it. So that is always my message to the young folks that I work with every day at HIPS.
We have to make sure everybody remembers what HIV did so we don't repeat that. We can't sweep it under the rug. Let's keep it front and center.
This will be a valuable opportunity to encourage others to continue based upon even the interviews and the project that's being put forth, that we do remember the past in order to pave our way into the future.
So it was a difficult time, but we survived it. And I carry with me the spirit and the strength and the power and the life experience and just all those lessons learned from people who I've touched and who have touched me. And it was a difficult time, but I never want to forget it. I never want to forget it. That's why it's so important to have these kinds of experiences where you can document the narratives of people living with HIV who have a lot to teach us about what it was like to survive those early days and to live to tell and to be able to inform the next generation.
We have what's needed. We just need to pull it together. We need for, and not just for the community to do it, but we need to have the policymakers, the researchers and everyone to continue to work together to make sure that what people need, what the community needs is in place so that they can access it, so that they can have the quality of lives that they deserve to have.
As a scientist and as a human being who's been involved in this epidemic since the beginning, I'm hopeful that the power of the human mind will be able to overcome the technical obstacles and be able to make progress towards an effective vaccine and an effective cure for persons living with HIV.
To end the epidemic, there should be no new infections, and there should be a cure for anyone living with the virus.
Knowing that it's still continuing, you may not hear about it as much, but there are those that are still here, still thriving, and we, in this generation, I think we will find a cure.
There is so much more that you can reach for, so there should just be no limits to rid the earth of this virus.
I have to have hope, and I believe there is reason for hope when we think about the next generations to come.